My name is Dan Byck. I regularly participate in skiing, hockey, mountain biking, running, working out. I am a board-certified orthopedic surgeon. I am fellowship trained in sports medicine with expertise in the shoulders, elbows, and knees. So the primary aspect of my practice will be arthroscopy, which means using a small camera device to enter into the joint to fix or repair damaged tissues utilizing a camera and a video screen. So we're really making very tiny little incisions in the body, that anywhere from 1/4 to 1/2 of an inch, and we're able to effect repairs that 10-15 years ago required a 6-inch incision going through muscle tissue. My take on injuries would be sports specific and injury specific. Essentially, when you train to deal with sports injuries, it incorporates soft tissue injuries such as ligament tears, meniscal injuries, shoulder dislocations, things like that. When we have people skiing and boarding and riding downhill mountain bikes at 60 miles an hour, the injuries are not minor. You rarely get a little dink. I mean, there's lots of bumps and bruises, but if you go down at a high rate of speed, something's going to give. So we often see major ligament injuries. We often see major fractures, even open fractures where the skin is, the bone is actually coming through the skin. And these injuries tend to become more severe with speed. The rate of injury in skiing is, in terms of shoulder versus upper extremity versus lower extremity, is about 70% lower extremity and 30% upper extremity. The rate for snowboarding is exactly opposite of that, where it's 70% upper extremity and 30% lower extremity. So depending on your sport, that's what you're more set up to injure. Very important for us to be able to understand each athlete's needs. And you'll find that if you come in, you may have a shoulder that's unstable, but you're in the middle of your season. Well, I'm going to try to make it so you can finish your season. And then if we need to do an operation, that is when we do it. We try to work it so that you're able to finish what you need to do. Unfortunately, for fractures and things like that, and some instabilities, that's not possible. But when it is possible, that's how we'll handle it. There's no reason to go on a sport that's faster than running where you're not wearing a helmet. Kayakers wear helmets. A lot of skiers you see today are wearing helmets. Snowboarders are wearing helmets. There is at least 3 or 4 people every year that you read about in the newspaper, and this is not scientific, but that crash into trees without helmets and die. There are people who wear helmets and hurt their neck and don't make it either, but at least you're giving yourself a fighting chance. And remember, while on the slopes, if you don't stick it, just pick it.